Collection of donor blood. Preparation of the venipuncture site will minimize the risk of bacterial contamination. Drawing will be done with a septic technique. Scrub the site for a minimum of 30 seconds. General information. Maximum collection should be no more than 10.5 milliliters of whole blood per kilogram of body weight, including samples. Medications must be evaluated by a medical doctor. Platelets from donors who have taken medication within 48 hours that irreversibly affects platelet function, such as aspirin, must not be used as the only source for platelets. They can, however, be part of a pool of platelets. Donor selection and blood collection. Criteria for donor selection include age greater than 16 years or conforming to state law, oral temperature not exceeding 37.5 degrees Celsius or 99.5 degrees Fahrenheit, blood pressure not exceeding 180 systolic and 100 diastolic, hemoglobin or hematocrit levels at 12.5 grams percent or greater than 38%, pulse between 50 and 100 beats per minute, and a minimum weight of 110 pounds or 50 kilograms. Donor deferrals, 1 year. Possible exposure to hepatitis, HIV, or malaria. Test alertal donor deferral. Hepatitis B immune globulin. Possible exposure to hepatitis, HIV, and malaria. Recipient of blood or blood products. Tattoo. Mucous membrane exposure to blood. Skin penetration with instruments contaminated with blood or body fluid. Sexual contact with an individual symptomatic for any viral hepatitis, confirmed positive for HB-Sag or HIV, or in a high-risk category. From completion of therapy for syphilis or gonorrhea or reactive STS, traveled to an endemic area for malaria with or without anti-malarial drugs, and were free of malarial symptoms during that time. More than 72 hours in a correctional institution. Plasma preparations without red cells are exempt from these restrictions. Malarial parasites are intracellular in red cells. 3-year possible exposure to malaria. Viral diseases. Viral hepatitis after age 11, positive confirmatory test for HB-Sag, repeatedly reactive test for anti-HBC, donated only unit to recipient who developed post-transfusion hepatitis, HIV, or HTLV, present or past infection of HCV, HTLV, or HIV, evidence of parenteral drug use. Other diseases. Received dura mater or pituitary growth hormone of human origin. Family history of CJD or risk of VCJD. History of Chagas's disease, babesiosis.